So hello friends, this is a video from Jakarta. Tomorrow we'll be going to Kuala Lumpur, and you'll see here that's a view on on Kuala Lumpur. I'll close now the window because it's like sun is setting, and I guess you've never seen such a good haircut. We have been today, everybody at the coiffeur here in Jakarta, and I can say it's maybe the best. So, but also food is good here, and Jakarta is a lovely place. Anyway, I have my lovely niece here, Isabella, and she will be now my test person for you to show you really the simple way of getting the laser going, getting a basic treatment. I will not talk about diagnostic part, but I will not talk about the possibility to imprint substances. I will not talk about combining it with the core system. I show you the simple way of doing it, and because I always get questions, well, where's the manual? And I tell people, this is a device in process. It's a discovery process, but there's only two ways usually people see. Either they have not enough information, they don't have enough manual, so they cannot start. And then once they have a big manual, like now with the big manual of Catherine LaesEr, which is 500 pages about the core system software alone, they say, oh, that's too much. I will never be able to learn this. So it's really, the challenge is to start where you are and to make it simple, to keep it simple, because this is my life, because there are so many ideas, so much input from everywhere. Keep it simple, start where you are, and then you will have not only a successful life, you will have a happy life. I tell you, it's as simple as this. Start where you are, keep it simple, and don't believe in authority. Don't believe that there's somebody who knows everything, that there's a protocol for everything, that there is a scheme how to do it. No, it's a process for everyone to learn it, and that's one of the main messages I'm giving you. So basically here we have now the new dual electrode for the feet, and now you just put your feet on here, yes. So then I want to say there's basically two ways to treat. Either you take the frequencies between the left and the right half of the body. This is good when you have obviously more or less an imbalance between the left and the right side. What does this mean? An obvious imbalance between the female and the male side, an imbalance between personality and the essence of a person, the imbalance between too much mind versus too much emotion. So when you see something like this, often you see that one eye is bigger than the other, or there is one side is more stressed and in a cramping state, where you see like the shoulder goes up. You see there's a difference, an imbalance between the two sides, and then I would always use this foot electrode, because it takes really the frequencies from the two sides of the body. And it's always the same. You need always those two. I'll show this here. You need always those two plugs be connected, the reference and the body voltage. Always when you do therapy, it's always the same thing. Now, when you apply the frequencies back, it's always channel 2 of the health integrator. It's as simple as this, always. So you have those three connections you have to make. Then you have to decide where you apply the frequencies. And that's also very simple. Either you put it where there is pain. Or if there's nothing in specific, you put it on the belly, because this is where your mother connection was, your umbilical cord. That's a very grounding experience. Or you put it on the solar plexus. This is where all the emotional energy channels come together. But of course, without something on top, it has to be on the skin. So now for Isabella, I want to show you first, I mean, she is not really having a problem between left and right side. I want to show you here just how to do this. Important when you apply the frequencies, especially if you have a very sensitive person like Isabella, you put this all the way down to 0. Whatever the switches are here, if you have this to the left, nothing will come out. Then I always have here two possibilities, a homeopathic mode and an inversion mode. The inversion mode is basically confronting you with your own frequencies, but with a phase shift or an inversion shift. So now, when do you use the inversion? When there is stagnation, when there is paralysis, when there is kind of lack of energy, less of impulses, then you use the inversion mode. But if there is too much anxiety, if there's too much nervousness, if there's not enough feeling of groundedness or feeling of self, you use the homeopathic mode. So it's about 50-50% of people have one or the other. So now for her I use homeopathic mode because you see she's giggling a lot, she's always everywhere. So now I use the head electrode and ask her, you just hold it here, okay, so now, good. So now for the general therapy, I always have the middle one in 50-50, because this is where we are mixing frequencies from something that comes from core and something that comes from the person. But in this case, where we have core not connected, it's fine to leave it 50-50, and then we can actually turn up, if we want, we can turn up the intensity here. But let's leave it at 1 volt for her, very sensitive girl. And because we do therapy, you have it here in therapy, we could turn up the amplification if nothing comes up here. But what the person, what the client receives is channel 2. So here we have 1 volt, that's what we have now. So you don't need to hold anymore. So how do you feel? Do you feel anything? Feel anything? No? Good. I can speak with everybody in the world, everybody speaks English, but in Brazil, even though she had 3 years of English, nobody speaks English. So anyway, so now the next question is often how to position the person. If it's about grounding, it's a good thing for the person to sit, and also to sit with a straight back. It's not always the best to have the most comfortable chair and lie like this. If a person needs to get a center in their life, needs to get awareness, structure, a feeling of sense of self, of being true to themselves, of setting limits. It's not good for them to be treated lying down or in a big comfortable chair. This is the new age nonsense. So don't don't go always for the same thing. There's really also in this aspect, there's two ways. One would be to either sit straight, tell the person to keep her straight back, or even to stand up during the treatment. And this is connected now with her head. So basically, what we are creating is a polarity between her head and her feet. So it's basically creating this polarity, this electric potential between the top and the feet, and this is centering. It's centering. See, she needs centering. She's always giggling, always some. I like it. I love it. I mean, it's very, very good for me. It's to see the life and to see the happiness, but centering is very important for her. So basically, that's all I would do in this way. To repeat again, keep it down 0 when you apply the second applicator, in channel 2. Then turn it up to 1, 2, 3 volts as the person feels alright. Keep it in either homeopathic mode if you want to do a calming, or in the inversion mode if you want an activation mode. That's it for this part. So now I show you how to do this while lying down. So now that's the other possibility. Have somebody lie down. It's actually even better than maybe in a very comfortable chair where the whole spine is totally out of alignment. And it's for the case where people are overstressed. But again, not everybody is overstressed. 50% are overstressed. 50% almost like this have to get centered, have to focus, have to get their life, their body, their mind aligned. So for them it's better to sit straight or even to stand up. So for now, this way would be lying down. And as I said, there's the second possibility is that you don't take the frequencies between the two halves of the body, but between the top and the bottom, the feet. And again, you need those two connections here. Yes, again, body voltage and reference. And in this case here, the body voltage goes to the head, and not like before where we were applying the frequencies there. It's where it's reading the frequencies, always in reference to what, and the reference is here, the foot plate. But here we need only one connection. You see, when you put the feet perpendicular, you have it on the same potential, so you have only one connection. So between here and the head, we are taking the frequencies. Now, the third one, again, channel 2, health integrator, where do we apply it? She has often problems with hurting her belly, so we put this there. So, and then tell the person, keep your hand there, yes, like this, very good. Good, and close your eyes, and then it's good to have the CD from Catherine to get even more focused, or some music. And this can go on. That's also the second question often. How long, how often? This you can do as long as the person feels comfortable and as much as you'd have time. But half an hour is no problem, 1 hour is no problem. And I can say, you see, I'm carrying this with me around the world, here now in Jakarta, Indonesia, and I do this every day, and I know it's good for everyone. You don't have to have anything. It's centering, it brings you back to yourself, and that's really LaesEr stands for, life amplification by energy stimulated eigenresonance. So the energy comes from yourself, amplified to stimulate more of your eigenresonance. So much for this. See, sometimes like with her, when the body absorbs more, especially when you're on 1 volt, the light goes off. Then you have just to increase again the amplification a little bit to bring it back here. But that's only, you have to check if somebody is very sensitive and you have it on the lowest level of amplification. Otherwise, you can just let the person lie down, and usually often people go to sleep. That's fine too. So much about this. And as I say from the beginning, start where you are. Don't have too much doubt in yourself, and the laser will help this even more, this process. And thank you from Indonesia. And there's a very nice way to say goodbye here. It's like this and like this. Always, if you go to the hairdresser, they say thank you like this, and they say thank you like this. It's wonderful, and the people here are way more centered, of course way more happy than in USA or Germany or Europe, and that shows in many things, yes.